In the past, we talked about a lot of different muscle problem that could give you neck pain. In this presentation, we're going to talk about a muscle issue that could give a specific problem to you, such as disrupting blood flow to your shoulder or arm. This condition usually is called thoracic outlet syndrome. You will have numbness in your hand, you lose probably grip in your hand, you have pain in your shoulder, blood flow to your arm is going to be disrupted. You will have discoloration in your hand. You will have cold hand. These are all the signs and symptoms that you will have in thoracic outlet syndrome. Now, let's see how this happens. Usually when you have thoracic outlet syndrome, also the quickest thing people realize is they start having their hand gets tired very quick. Let's go back from the beginning. You realize there are a lot of muscle in the back of your neck and in front of your neck. Most of this muscle, they have some type of spasm related to them when you have all the symptoms. The most common one in our thoracic outlet syndrome is right above your collarbone in your neck. And the way to detect that if you have that problem, what we do, we check your pulse. And while we're checking your pulse, we're asking you to rotate your head to side or even extend it back. And if your pulse diminishes or disappears, we're pretty much sure the problem is vascular, not neurological. The way it works, a major artery leaves the heart. It's called aorta. And then from that artery, a smaller artery called brachial artery branches out. And it goes slightly above collarbone and then goes all the way to our arm. And when people check our pulse, this is the artery that people check, is brachial artery. Now, this artery passes through a muscle we call anterior scalenus muscle. And when this muscle goes to spasm, interfere with the blood flow. And the worse the spasm is, the bigger the interference. And that's how the pulse might diminish or altogether disappear sometimes. And you may have cold hand, numbness in your hand, pain in your shoulder. All that's the symptom that we talked about previously. Now, how to treat thoracic outlet syndrome? The very first thing we do in our office here in Soft Touch Chiropractic in Port Ranch, we do manual therapy in order to increase the range of motion of the neck and shoulder, especially stretching and massaging those affected muscle. Sometimes if the patient is not allergic, we're using muscle relaxant, natural muscle relaxant such as arnica while we are massaging the neck, and we stretch the necks, and we are using a technique called PIR, post isometric resisting exercises, or basically we do electric therapy. Now, the electric therapy we do in our office, we call that active electric therapy. Active electric therapy, while we have an electrode on affected muscle, we ask you to do certain movement and certain exercises. This way, while you get in electric therapy, we have multiple muscle gets treated at the same time. Instead of 3 muscles being affected by electric therapy, we do therapy maybe on 10 to 12 muscle at the same time, and the benefits is exponentially higher. Next therapy we may do on your neck is called ultrasound therapy. Now, ultrasound is the most common question in my office is asked about any physiotherapy modality is ultrasound therapy. Basically, what is ultrasound? Imagine you standing next to a loudspeaker. What do you feel? You feel vibration in your body. Especially the louder the music is, the more vibration you actually feel in your body. Ultrasound uses the sound that you cannot hear, but the vibration it does affect in your soft tissue of your body, especially tendons and ligaments. Also, it helps relax the muscle. So, ultrasound therapy is one of the most effective most physiotherapy modality in chiropractic offices is being used today. We could ask patient promote the better posture. Now, when people have better posture, they relieve some of the pressure out of their upper back and the neck. And we promote that patients sleep better in better posture. Believe it or not, most of the injury to our neck happen during the sleep. Also, most of the muscle spasm is emotional, and stress could cause good portion of the muscle injury in our body due to stress. So we do ask patients to have mental relaxation, do some type of mindful meditation, and believe it or not, that is a very helpful. In previous video, we talked about how a small paravertebral muscle could misalign your vertebra. Please go back in our YouTube video and watch them. It's a very good information about neck pain. However, even with thoracic outlet syndrome, it's very important that when you have subluxation or misalignment of the neck, get adjusted. And that also something could help thoracic outlet syndrome to relieve the pressure out of the nerve that causes the muscle to go to spasm. Have a great and healthy day. Thank you for listening to this video presentation.